this is a very important slide because in the management of dyslipidemia, now newer recommendations say that a non-fasting lipid profile is good enough, and after patients are already on 40 milligrams of rosuvastatin plus ezetimibe or 80 milligrams of atorva plus ezetimibe, do a lipid profile at 4 weeks. If you achieve the target less than 55, and at 3 months it continues to be less than 55 with a non-LDL cholesterol of less than 85, and that's where we want to be. But if it is more than 55 after 4 weeks, then you add bempedoic acid to the first two drugs. Again, if it goes to less than 55, we are happy. We keep regularly checking at 8 weeks and then thereafter 3 monthly. But if it is more than 55, this is the situation where after adding the three drugs, you can add PCSK9 inhibitors. And this should all be done within 4 weeks and 4 weeks again of testing, just to make sure that your LDL and your non-HDL cholesterol goals are within the required range. Now, the Cardiological Society of Indian guidelines recommend that in patients with ACS, if the LDL target of less than 55 is not achieved with high-intensity statins, ezetimibe, and bempedoic acid, then PCSK9 inhibitors or Inclisiran can be administered. This is part of our guidelines, and we should take this very seriously. Now, we have nice guidelines which have recommended Inclisiran for atherosclerotic heart disease and heterozygous familial hypercholesterolemia, which I've put up for y'all. Bempedoic acid and ezetimibe and Inclisiran are available in primary care and do not require initiation by specialist services. PCSK9 inhibitors may be available for prescribing in primary care centers. Now remember, these nice guidelines from UK have now empowered physicians at all levels to start initiating these molecules because they have recognized the importance of LDL cholesterol reduction. And similarly for Inclisiran is also included in the secondary prevention pathway, where they should be brought, as long as the LDL stay above target, the Inclisiran should be initiated early. Now, the ACC consensus guidelines also has a recommendation similar, where where bempedoic acid and Inclisiran can be considered when they are not controlled with statins and ezetimibe. But it's important to get target oriented so that we get the correct outcomes that we want.